An innovative blood test that can detect over 50 types of cancer has shown significant promise in a major trial conducted by the National Health Service, NHS, according to researchers. The test accurately identified 2/3 of cancers among 5,000 individuals who had visited their general practitioner, GP, with suspected symptoms in England or Wales. Moreover, in 85% of positive cases, it successfully identified the primary site of cancer. The test, known as Galleri, analyzes specific changes in fragments of genetic code that are released by different types of cancers. Detecting treatable cancer at an early stage can have a profound impact on saving lives. Although the test is still considered a work in progress, the researchers from Oxford University believe that it has the potential to increase the number of identified cancers. Many patients present with symptoms such as weight loss, which can be attributed to various causes, necessitating multiple tests and hospital visits. In the largest study of its kind involving patients with suspected cancer symptoms, over 350 individuals were ultimately diagnosed with cancer using traditional methods such as scans and biopsies. Among those who tested positive on the blood test, 75% were found to have cancer, while 5% of those who tested negative were still diagnosed with cancer. Lead researcher Professor Mark Middleton emphasized that although the test is not yet accurate enough to definitively confirm or rule out cancer, it provides valuable assistance to physicians. He explained that the test achieved an 85% accuracy rate in determining the origin of the cancer, which is immensely beneficial as it is often challenging to determine the necessary test based solely on a patient's symptoms. With the predictive information from the test, doctors can decide whether to order a scope or a scan, ensuring that the most appropriate test is conducted initially. The findings of this study will be presented at the American Society of Clinical Oncology Conference in Chicago. In addition to the trial involving patients with suspected symptoms, the NHS has also been employing the Galleri test in thousands of asymptomatic individuals to identify hidden cancers. Initial results from this ongoing initiative are expected next year. If successful, the NHS in England plans to expand the implementation of the test to an additional 1 million people in 2024 and 2025. The Galleri test demonstrates particular effectiveness in detecting elusive cancers, including those affecting the head and neck, bowel, lung, pancreas, and throat. Dr. David Crosby from Cancer Research UK acknowledged the potential of the test in supporting GPs in their clinical assessments. However, he emphasized the need for further research in larger trials to evaluate whether it can enhance GP assessments and ultimately improve patient outcomes. NHS National Director for Cancer, Professor Peter Johnson, hailed this study as the initial step toward testing a new, expedited method for cancer identification pioneered by the NHS. Early detection of cancer is crucial, and this test has the potential to identify more cancers at an earlier stage, thereby potentially saving thousands of lives.